Just like having the right information is necessary to make solid hiring and lending decisions, being engaged in our community is important. DataFax is proud to support the positives and be a presenting sponsor of the Spark.
State Systems is focused on protecting life and property. As a local, privately owned company, our foundation was built on providing all businesses with complete fire and security protection and infrastructure cabling. State Systems is proud to be a part of the Mid-South community and a presenting sponsor of the Spark.
Lipscomb Pitts Insurance has been serving the Mid-South since 1954. We've always focused on supporting our community and believed in promoting the positives, encouraging engagement, and leading by example. Lipscomb Pitts is proud to be a presenting sponsor of the Spark.
Additional funding provided by Christian Brothers University and Baptist Memorial Healthcare. Get better with Baptist.
This month on The Spark, our theme is health. We'll learn more about a regional health and healthcare improvement collaborative that's working with over 200 community partners here in the Mid-South, a nationally recognized organization known for its state-of-the-art wellness centers and focus on youth development, healthy living, and social responsibility, and a health insurance provider dedicated to empowering you and your family to live a life that's healthy, active, and rewarding. Have you ever been excited by a new idea, inspired by watching someone lead by example? When we talk about creating change, we start by sharing the stories of everyday heroes who are making a difference in their own way, so we can learn and do the same. This truth is the power behind this show, which is focused on business and community leaders that are leading by example to give back, fuel change, and create new opportunities for the Mid-South. I'm Jeremy Park, and this is The Spark. Their mission is to mobilize Greater Memphis to achieve excellent health for all. I'm here with the CEO of Healthy Memphis Common Table, Renee Frazier, and you're a collaborative, so you pull together 200 different community partners, all focused on excellent health.
That's right.
Describe Healthy Memphis Common Table, though.
Well, we've been around 10 years. We started in 2003. I've been here 5 years. And it's very important to note that real focus when we started was on obesity. We continue to keep that as an issue for us. Obesity rates have begun to flatten, but we are still a highly obese community. We focus also on healthcare quality, health disparities, as well as activating consumers to be more engaged in their health and their health care. Very, very important element of our work.
And that's a big key is you're on the front end, you're working to be proactive on the health, so it's physical exercise, eating right, all of those things that go into that pipeline. But also, too, it's empowering them with the data, the information, so that they can take charge.
Take charge is important. And the other piece is that we know healthcare costs are impacted by lifestyle. So right now we know obesity is about $553 million in our region over the cost that we would expect for healthcare. We know it's an issue. Employers are spending about $1,500 more per employee because they are obese, and as a result of chronic disease. You end up with diabetes, hypertension, heart disease, some cancers, arthritic issues. So as a result, we really want consumers to understand that, and right now they don't. So we want them to know their numbers. We want them to know healthcare costs. We produce take charge reports in this market. We've done that for the last 5 years since I've been here, about 8 reports to really heighten the issues of overuse of the emergency room, readmissions, unnecessary, potentially avoidable hospitalizations, because they're not accessing the system appropriately, and they have multiple illnesses because of their health habits. It's a major issue for us.
And that's where, when you look at it as a community, the emergency room visits is such a high charge. And so if we can get people on the front end to have better health, that keeps them away from the ER, and all of a sudden now, as a community, we're saving, and we can also, we're better equipped for those real emergencies.
It's so important because it also, as you said, it makes us better equipped to use the emergency room appropriately. And from an employer's perspective, we want to have employees that are healthy, and we don't want to have high healthcare costs, because employers do look at that when they make decisions about Memphis, which is a great market to come to, but we want to make sure we're managing our healthcare costs as well.
Talk about nutrition and food deserts. You work in that area.
Oh, we work very much in that area. You know, we have about 14 farmers markets. That's been something that we've been very involved in. Not the only organization, but very much a voice for that. We also have a mobile farmers market that we help develop in this market with the University of Memphis School of Urban Development.
Nice.
And very key, it focuses on visiting senior centers. I actually personally have done this and go out to these senior centers, but it's only a short-term fix. They don't have a grocery store or a full-service grocery store within 5 miles of their homes. Wow. So this gives them an opportunity to buy fresh fruits and vegetables, and they take food stamps or SNAPs. So that's a big deal. We were one of the advocates to make sure that they would be able to use their SNAP benefit. This was very key, very key, very key.
One of the other partnerships that you have is with Leadership Memphis, and this ties into something we're going to talk about later on.
I love it. I love that
$1 million calorie reduction match.
Yes.
So let's take a quick look at your partnership with Leadership Memphis.
Great, great.
I was approached about the million calorie reduction match. It's pretty easy to provide people with good information so people can make good decisions about their lives. We are an organization of leaders, and so it's important to think about what kind of positive change can you have with someone's health. Certainly there are lots of ways to approach health, but the calorie match seemed to be something simplistic and easy for people to participate in. We put the food there. We simply put how many calories each item is, and they have to then use that information to make the best decision possible. If we can have just a little bit of impact, then if more and more organizations will also pick up that banner and say, obesity, it's not worth it. We can do better. We just have to provide people with the information so they can make good choices.
So that gives us a little teaser on Leadership Memphis, but also to the million calorie reduction match. And a big part of this is healthy vending, healthy meetings, and then also to physical exercise.
Absolutely.
Describe, though, the million calorie reduction match overall.
Well, we got some funding from Robert Wood Johnson Foundation, who wanted to focus on population health. And for us, obesity rates in this community are significant. We've been improving, but we're still in the bottom third when you look at it nationally. But we have improved. And the focus on policy, not legislative policy, but leadership, changing to a culture of healthy is what we wanted to do. So we picked 3 policies, 1 on vending machines, 2 on healthy meeting policy, 3 on activities. The vending machine policy came from some work with the Memphis Dietetic Association. What we found, this is how we came up with this name, million calorie. What we found is that on the average, if we would change a vending machine 50%, this is the snacks, the food vending machine, not the soda machines, it would reduce 1.1 million calories a year.
And so just imagine, I mean, replacing the candy bars with the 100-calorie snack.
That's exactly right. And we're not saying don't eat candy bars, but if you're going to eat them, can you eat a smaller one? 100 calorie versus 375 calories. It's a big difference. And the activity piece of this is critical because what we do, we label the food that you eat. So Leadership Memphis is a good example. We knew going out to organizations one-on-one was too hard. We tried it. It was too hard. So David Williams, CEO, said, hey, Renee, we're willing to test this out. So what we do with them now, they basically have 80 leaders that go through their leadership classes every year. And as part of their curriculum, as well as part of their culture, they now have our calorie labeling on their menus. They even had at an event of 800 of leaders, food trucks that we work with, and then they had the calories laid out on these food trucks that people were walking around eating and looking at what the caloric intake was and how many calories was going to take to burn it off. Which
that's
is very
impressive.
important. Very important.
There again, though, education is power. And so by realizing, okay, this is what I'm eating, this is what I'm consuming, but also, too, this is the caloric intake, but also, too, how hard I'm going to have to work to remove those calories, that's important. And so not only with the healthy vending machines, but also, too, you're encouraging companies to serve healthier meals during their lunchtime, their corporate lunches, their events.
No question. And, you know, the other thing we've done is we are identifying very specific caterers who will do that, who want to be early innovators. We're training them. We're educating the caterers to show them how to have smarter, better meals, which is very, very important. And Leadership Memphis is willing to do that with their caterers. So we think our strategy now is going to be basically to work with organizations and say, look, Renee, we use 5 caterers. Let me go talk to those caterers, see if they're willing to adopt at least 5 of our preferred choice meals and give that opportunity for them to provide that in their organizations and really encourage them to do that. That's what we're trying to do now.
And then the last piece of it, which I enjoy too, is encouraging physical activity. So doing things like walking meetings.
Well, I've been at meetings with stand-up meetings, doing 5-minute breaks in meetings. We really encourage that. Again, just having what you have to burn when you eat that brownie does make a difference. So we have 2 things going on at the same time. 1, be active in a meeting. People are doing that now. And 2, showing people what you need to do to burn off those calories.
Well, I greatly appreciate everything you're doing in the community. It's already making a huge difference.
I love it.
Thank you very much for coming on the show.
Thank you.
Known for youth development, for healthy living, for social responsibility. I'm here with the president and CEO of YMCA of Memphis in the Mid-South, Keith Johnson. You have a very long, amazing legacy, especially tied to basketball and volleyball. Give us the backstory for YMCA.
Thanks, Jeremy. The YMCA history is really extraordinary. starting in 1844 in London, England, in America, in Boston in 1851. Only 4 years later, the YMCA began here in Memphis. So 1855, we've been serving people in our community. Now, you mentioned volleyball and basketball, two Olympic sports, both started by YMCA employees. Most people don't realize Dr. Naismith was working for the YMCA at Springfield College, which was a YMCA college, when he invented the game of basketball. Only a few years later, a physical director at our Holyoke, Massachusetts, Y decided basketball was too rigorous for his noontime crowd, so he started volleyball.
So there you go, two bits of trivia right there.
Sports.
So you're known for your wellness centers, and when you go into the wellness centers, it's tons of activity. You have youth programs going on like basketball, you have the fitness centers over here where they're doing all the state-of-the-art exercise equipment, you have water, aerobics, and different things for swimming, all sorts of stuff, but lots of activity. How do you describe the wellness centers?
Oh, our wellness centers work with people literally from early age to seniors well into their 90s, helping to keep people healthy and active. We have about 45,000 members throughout our system and our 9 branches. Our most recent branch, we took over a space in Oxford, Mississippi. But I think if you asked 10 people, you'd get 10 different answers on what their memories of the Y is or are. It could be that they were in day camp, or they have kids in sports programs, or play basketball, or they learn to swim at the Y. We have about 5,000 swim lessons a year through our branches, and of those, about half of them are for kids free of charge.
Nice.
Because we have a difficulty in this community with kids drowning. We want to be sure to try to prevent that as much as possible.
And so you also have a number of initiatives that are keenly focused on different things like arthritis, cancer surviving, and cancer patients. We'll talk about those in a little bit, but one of those is diabetes prevention.
Absolutely.
Talk about that.
I'm really thrilled with the new initiatives that the Y has taken on, including diabetes prevention, and it's all evidence-based, and it's really piloted by YMCAs and has seen tremendous results. So far, something like 56% of participants that go through this program are successful in keeping away from diabetes. And for people over 60, it's like 71%.
Wow.
So we're doing this now. We're working with both companies and individuals to try to help them prevent their employees or individuals from moving from pre-diabetic to type 2 diabetes, which is an incredible return on investment. It's about a $400 program, but like $14,000 once you're a diabetic, it costs a year for them to maintain. Oh, incredible.
Well, let's go ahead and take this moment. Let's show viewers a little bit of a day in the life of the YMCA, but also, too, a little bit more about this program.
So the YMCA's Diabetes Prevention Program is a year-long program that has 16 core classes. They're conducted on a weekly basis. The program has 2 goals. One is to reduce the weight of the participants by at least 7% of their initial weight, and that for the participants to achieve a total of 150 minutes of physical activity every week. Those 2 goals, when achieved, reduce your risk of developing diabetes by 58%. My participants are weighed. When they come in every week, we have to weigh. So then I'll facilitate a conversation. They get to learn from each other and share their experiences, and therefore feel as though they're part of a group. They have to track all the food that they eat. You're then able to be conscious of what it is that you eat. Those people for whom the doctor has told you, you know, you are pre-diabetic, I say give us a call, and this class would be good for you.
So that gives us some perspective on a typical day in the life of YMCA in the Mid-South. We talked about diabetes prevention in that program. You have another one, though, tied to the Livestrong Foundation and working with cancer patients, cancer survivors. Give us some more detail on that program.
Oh my goodness, cancer survivors, those individuals undergoing treatment really need a support group. They need activities, and they need nutrition to really overcome the treatment. You know how tough it is, and every family has been affected by cancer in some way. We've found amazing results working with the Livestrong Foundation for people who go through this program, and it's free. It's a free membership for Livestrong survivors, and it helps them to reclaim their health. The support group is a big part of that. So we're all about healthy living and helping people to deal with the cancer situation.
And then talk about Enhanced Fitness, because that's another important program.
Enhanced Fitness is for arthritis individuals suffering from arthritis. Helps them to overcome those obstacles that it throws in their path. Helps them to reclaim their health and to be living independently as long as possible. So it's not just for seniors, although that's a big part of the population, but anyone who deals with arthritis symptoms, it helps them to reclaim that independence.
Nice. And then, so when you look at it, there's a ton of ways to plug in and enjoy the YMCA in Memphis and the Mid-South. We talked about, obviously, memberships for the wellness centers. You have volunteer opportunities, but one big one, especially for corporations, is corporate games. How do you describe corporate games?
Corporate games is on its 6th year now. This last September, we had 37 companies and nearly 1,700 employees. It's amazing to watch the teams from the different companies participating together, from the executive level to the frontline level, all playing games of tug-of-war and basketball and volleyball and kickball and riding tricycles. But the fun thing, the thing that we found from most of the companies is that it creates a new enthusiasm, a new camaraderie among their employees, and it encourages employees to be healthy. So
and when you look at it, obviously that ties back to the mission.
Absolutely.
And so you've got the volunteer opportunities, you have corporate games, you have the wellness centers, and you have the memberships there, but all of that comes together to create this synergy for you to be able to do these programs. You alluded to the Livestrong Foundation and that partnership, which is a free membership for those. All of that is underwritten, obviously, through the YMCA. So talk about overall this synergy of being able to pull all these sides together to benefit the community.
The Y is a not-for-profit organization. We're also a United Way agency, so we receive funding from both United Way and foundations, but we also have a public support campaign to help us to offset those costs associated with Livestrong and working with teenagers, working with young kids, swim lessons. None of those are affordable, feasible if you just looked at the bottom line. But we want to make these programs available to anyone in our community and to make our community overall healthier and happier and more productive.
Well, there you go. I greatly appreciate you coming on the show and sharing that and everything you're doing here in the Mid-South. Thank you very much, Keith.
We appreciate it.
Theme of health and wellness, it's only natural to talk about health insurance, so we're here with Larry Loew of Humana. And when we say Humana, you actually have a very unique evolution to what you guys are doing today. So talk about the evolution of Humana.
Yeah, Humana started back in the 60s as a nursing home company, became the largest operator of nursing homes in the world. We then evolved into the hospital business and became the world's largest operator of hospitals. Yep. Back in the 80s, got into the managed care health insurance business, which we remain in today. We've branched out into several other product lines and are pretty well known nowadays for our work with seniors and the Medicare programs.
So overall, you cover a pretty wide bandwidth. You've got the health insurance, dental, vision. Walk us through some of the different products and services, though.
Yeah, we sell and administer health, dental, vision, worksite products, some life, disability, those kinds of products for different market segments. And as I said, we're heavily involved in the Medicare programs and really have evolved over the last couple of years into more of these health and well-being products that, that we administer for employers.
The big trend, and that kind of alludes into what we're going to talk about, is the fact of being typically what is reactive, where you go to the doctor, go to the emergency room, and that's obviously where health insurance plays a very vital role, but now being proactive. So on the front end, giving them the tools, the resources, all the necessary information so that they can take control of their health. And obviously that eliminates a lot of the need to go into the emergency room or the doctor, and so it's being proactive on the health side. Talk about that trend and what it means to Humana.
Yeah, you know, it's we've recognized that health and poor health is a big problem in the United States. It's a $70 billion a year problem for related to obesity. So we've decided that that's something that we have an ability to affect for employers. So we began this relationship with Humana Vitality about 3 years ago. and really have embraced that as kind of the next phase of our company.
And so this is a really amazing incentive and rewards program, and it starts out obviously with all the biometric screening, so you get the information from the employee, from that individual, and you get their history, their family history, all this stuff, so you figure out their chronological age, and then you actually look at their real age in terms of their lifestyle and the lifestyle that they're living, and then all of a sudden it creates a personal pathway. How do you explain Humana Vitality overall in terms of the goals and the focus of the program?
Yeah, I mean, it's really designed to create realistic goals for that employee. So we collect that information on the front end, as you said, with a health assessment. Ideally, we get biometric results that will really paint the picture for the employee around, how does their lifestyle impact their health, and then it creates this personal pathway, realistic goals, and it rewards them and incents them along the way for achieving those different milestones.
Well, let's go ahead and take this as an opportunity to go and show viewers a little bit more about Humana Vitality.
Today we're doing the Humana Vitality Roadshow. Humana gives you the option of earning rewards for doing things to keep yourself well. So today we have lots of information about healthy eating, competitions to lose weight. We want to show people what their everyday blood pressures are to see, they may never go to the physician, so they don't know if they have high blood pressure. So if they recognize that here, that's something that they can bring up and get treated for. Fruits and vegetables are the things that will help you lose weight and be healthy and lower your cholesterol, make your blood pressure better. So we wrap the tape measure around that to show that losing weight and eating those things will help you overall, and it's something that can be a family change too. The more points you earn, the more rewards you get, essentially. And now we're at a year's point into the program. We're trying to keep people engaged, getting them earning those points and show them how much rewards we've earned, so that way they can earn those same rewards themselves.
So that gives us just a little perspective on Humana Vitality, but this is not your typical rewards and incentive program. You're doing crazy stuff like monthly jackpots and fitness equipment, and when you look at it, you're stair-stepping people with realistic plans. How does all that come together?
Yeah, as we mentioned earlier, we collect as much information as we can from that employee on the front end, and with that we build a personal pathway for them. So it is designed to build reasonable goals for them to achieve. So as they reach those goals, there are incentives for them along the way that reward them for having achieved those goals. So for example, if somebody needs to lose weight, it might encourage them to lose 8 pounds over a 3-month period rather than 28 pounds, which might be their ultimate objective. So it provides those realistic goals, incents them along the way, and then rewards them on the back end with things as simple as movie tickets all the way up through fitness devices.
Nice stays at hotels and all sorts of good stuff.
Exactly.
Didn't you buy a weed eater with yours?
I bought a weed eater with my money, yes sir.
So when you look at it, the other thing that I like about it is the fact that you tie in nutrition, you tie in resources, you tie in health coaches. So it's not just the rewards and incentives, you actually have a pretty full, robust program all the way around. And so that's exciting in terms of all that it enables you to do in terms of your success. The other piece of this, though, is that it ties back into a lot of your overall goals company-wide. And so you have the Humana Challenge, and there's a walk-it piece that goes with that. Talk about Humana Challenge.
Yeah, the Humana Challenge is a PGA Tour golf event that we're the title sponsor of. It's partnered with the Clinton Foundation, which has one of their objectives is to improve childhood health, improve health status of the communities that they're involved in, which matches up pretty well with Humana's kind of corporate mission. One element to the golf tournament is the Walk It Challenge, in which we track steps that people, either the attendees, spectators take along the way, as well as some of the players. Nice. So it really just helps to raise awareness to the benefits of an active lifestyle.
What about Humana Communities Benefit?
Yeah, that's something that we're real proud of. It's the Humana Communities Benefit is the charitable giving arm of Humana, and so we operate that in several cities around the United States. It awards a $100,000 grant to nonprofits in those communities, all with a focus on improving childhood health, reducing obesity rates, and encouraging active lifestyles. So
Nice.
we're real proud of that.
When you look at the impact here locally, I know that you guys over the years have been heavily involved in things like American Heart Association, Boy Scouts of America, Chickasaw Council, Baptist Foundation. All of those are tied to, obviously, youth, well-being, health focuses. What's your focus here in the Mid-South just in general?
Yeah, I mean, our focus in the Memphis area, obviously we are a known brand in the community. We have good relationships with employers like Baptist and others in the community. And we're always looking for ways to expand our relationships here. And that's something that we intend to do over time.
Nice. Well, I greatly appreciate everything you're doing around the nation and here in the Mid-South, and thanks for coming on the show.
Appreciate the time.
As we saw in this month's episode, when we talk about health, it's much more than eating right, exercising, and being free from illness. It incorporates your complete physical, mental, and social well-being, your body, mind, and spirit. It also encompasses community factors like access to fresh fruits and vegetables and emergency room capacity. It's no secret that cutting down on your calories and increasing physical activity will yield positive results, not only for your waistband, but for your life. But building a supportive culture is key for our families and our companies. So look at providing healthier lunches at work and lower calorie options in the vending machines. Try taking walks around the office for a meeting or for a short break. Get outside and spend time with your family. Look at a membership with an organization like the YMCA, where you have access to not only the state-of-the-art equipment, but also to classes and youth programs and other resources as well. The more we take control of our health and encourage others to do the same, the more we succeed together. So thank you for watching The Spark. To learn more about each of the guests and interact with your stories of others leading by example, visit thesparktv.org. We look forward to seeing you next month, and we hope that you'll join with us in creating a spark for the Mid-South.
Just like having the right information is necessary to make solid hiring and lending decisions, being engaged in our community is important. DataFax is proud to support the positives and be a presenting sponsor of The Spark.
State Systems is focused on protecting life and property. As a local, privately owned company, our foundation was built on providing all businesses with complete fire and security protection and infrastructure cabling. State Systems is proud to be a part of the Mid-South community and a presenting sponsor of The Spark.
Lipscomb Pitts Insurance has been serving the Mid-South since 1954. We've always focused on supporting our community and believed in promoting the positives, encouraging engagement, and leading by example. Lipscomb Pitts is proud to be a presenting sponsor of The Spark.